We're so excited to be back in our studio in Austin, Texas. Season 6. It's hard to believe, hard to imagine Season 6 of the Big Bid Theory, powered by Bid Prime, is off and running. I'm your very well-rested host, Bill Culhane. Rick Jennings, our producer, is on hand. We'll hear from Rick a little bit later. Kevin Henderson, our digital marketing guru, has been busy at work getting ready to launch the show's website. That's right. Very soon the show will have our very own webpage. Stay tuned for news on thebigbidtheory.com, and we'll have all things TBBT for you right there. In Season 6, we're going to visit with experts on a variety of topics: 5G, automated vehicles, cybersecurity. There's that topic again. Growth of cloud, and a number of important discussion items that we believe topics that are important to everyone to some degree. No better way to start Season 6 than to welcome in our resident public health expert, Dr. Rodney Rohde from Texas State University. Although we've been away from the microphones, it doesn't mean we've been out of touch. The coronavirus outbreak has, of course, been on the minds of many recently. Discussing the coronavirus problem, Dr. Rohde has been on local news, quoted in Time, Yahoo, a number of publications. He's the kind of person who focuses on sharing a wealth of fact-based information, and maybe the most important part of that is fact-based. April 8th through the 10th, Dr. Rohde has the ASCLS Alaska keynote and a breakout presentation and update on COVID-19 coming up. Again, that's April 8th through the 10th. Also ahead on his calendar, he has the AHE Iowa Regional Conference keynote, infection prevention control updates, and also the ASCLS National Meeting is on the horizon. Over recent months, he's been working at the national level, along with a number of peers, doing consultative work regarding the ongoing COVID-19 outbreak, as well as his various roles there at Texas State. Dr. Rohde has written, and I mentioned Time, I mentioned Yahoo, but Dr. Rohde has written 3 invited articles and conducted over a dozen or more interviews, podcasts regarding the outbreak. Google his name. You'll see all that he's been doing. So there you go. You don't want to miss it. Stay tuned for our visit with Dr. Rodney Rohde after this brief message.
The Big Bid Theory is brought to you in part by Bid Prime. Over 11 years in changing the bid services industry, Bid Prime has become the solution for businesses serious about winning public sector business. From the premier technology in the industry to real-time bid notifications, supporting documents, and robust data tools, it's all backed by unmatched, personalized customer support. Bid Prime. Start your free zero-obligation trial today. bidprime.com.
From the land of the beautiful San Marcos River in Texas State University, Dr. Rodney Rohde does indeed join us. Dr. Rohde, I'm not sure where this ranks on your list of honors, but I want you to know, with this appearance on the show, you are now the all-time leader in guest appearances on the Big Bid Theory.
Outstanding. That's great news. This is definitely ranked up there at the top of my list, Bill.
No kidding. Well, hey, do appreciate that. Now, on to more important, more serious matters. As is typical with you, anytime we've had you on the show, Dr. Rohde, we're more so limited by time than topics we can discuss. But as you look across not just the landscape here in the United States, of course, but around the world, COVID-19, coronavirus. I just looked this morning as you and I had this conversation on Monday morning, 10 o'clock Central or so on March 9th. It looks like the latest numbers, over 100 countries reporting cases, 105,000 cases reported worldwide of the coronavirus. You turn on the television, the Twitterverse, surf the net, speak with the cashier at the local grocery store. Coronavirus is on the minds of many. We're going to talk about precautions in a moment, but what else do those living in the United States need to know in terms of the coronavirus threat?
Yeah, it's really become an interesting kind of phenomenon for sure as I followed this with my 25 plus years of public health and medical laboratory background. It's certainly, Bill, been a bit surprising actually with respect to the amount of attention and the amount of concern going on, but we'll talk about that some today. But your numbers that you talked about there are exactly what I've seen as recently as an hour or so ago, so over 100K cases kind of globally, over 100 countries. We've actually reached around 4,000 deaths globally. with most of those cases, of course, in mainland China. But South Korea and Italy and Iran, some of those are kind of cooking now with about 7,000 cases. And just to lay it out there for our U.S. Audience, there's right now about 564 cases with 22 deaths. And so, we're sitting here and we're watching the news cycles, as you mentioned, and the stock market's kind of in a spiral. And it's definitely an interesting phenomenon right now. And I guess what I would urge to your audience, and what I've been doing anyway, is to keep following reputable sources, to keep listening to the experts, and trying to be careful with respect to being part of any kind of panicking or other types of sharing of information. Make sure that news is solid and trustworthy, and try to just follow the precautions and kind of normal things that we do in any type of major outbreak around respiratory illness.
I've been keeping an eye on the website for the Centers for Disease Control and Prevention to get some of my information, some of my background. Are there any other resources outside of the CDC's website that you think are solid sources? Because as you mentioned, I don't know if Facebook, I don't know if Twitter, I don't know if the local guy at the Walmart is the best source for info, but a lot of folks, I think, are turning to those sources.
Right. I think you're very correct on that. And so, again, those reputable sources, of course, the CDC is one of my all-time recommended sources, but the WHO, the World Health Organization, has a great site. I've also utilized, just being a Texas State professor, we've put together a nice website at Texas State with respect to kind of around university and educational concerns, which many people are concerned about. So if you're a parent of a student or you have a loved one in college or even high school and so forth, you might want to pay attention to your university or your local school district's website, their official website. Like you said, maybe not all the social media from different folks, but those official sites. And then I also like to kind of recommend people keep an eye on the American Society of Microbiology and Elsevier, and just kind of major reputable entities that have resource sites that do a good job of keeping up to date almost on the hour.
We've used the word precautions, and for those of you just jumping on at this point of our conversation, this is Bill Culhane from the Big Bid Theory with Dr. Rodney Rohde from Texas State University discussing COVID-19. We are having this conversation at 10 a.m. Central on Monday, March 9th. Dr. Rohde, we talked about precautions. As you may recall, I've mentioned before to you that my wife is an ICU nurse in Austin, Texas. And I know that there are a number of healthcare facilities in the city of Austin that are taking increased measures to try to protect staff, visitors, patients, etc. But as far as precautions go, and for folks who don't want to jump over to the CDC's website or the other resources you mentioned, what would you say to the average everyday person in regards to reasonable and important safety measures? We understand not everyone can buy a hazmat suit, live in a bubble, stop traveling, etc.
Yeah, absolutely. I mean, as I mentioned to some colleagues this morning, I just flew to Atlanta this past weekend for a keynote that I gave there. And the airports were pretty calm in Austin when I left, but Atlanta was kind of interesting because it's such a large international airport. People wearing, masks and being extra diligent with hand hygiene and wiping down seats and things like that. So let me kind of address this. This is a great question to answer, I think, for the general public. So certainly, we all need to be paying extra attention to hand hygiene, hand washing. But let me add a layer to that. I've been answering this for multiple sources. Hand washing is definitely important, always. But I think it's important that we're a little more diligent with what I would call watching out and being aware for high touch surfaces. So, and you probably know what that means. I talk about things like public touch screens, like you might scan at a fast food restaurant or something like that. We're all familiar with our iPads and our phones and things like that, but other public surfaces like that, rails, hand rails, those types of things. If you're doing an extraordinary amount of handshaking, so if you're going to a conference or you're going to an event or you're walking into an area with a large number of people, you might keep that in mind, and you might even avoid some of that with respect to other people's concerns and do what's called a little social distancing. So not to be unfriendly, but maybe keeping away from just piling into an area where you're going to be inhaling the same kinds of air and things like that. All very difficult when you're trying to be just, a normal citizen and being friendly. But it's certainly, I think, important to think about that more now as we move forward. And then just paying attention to the other things we've been talking about out there, like avoiding sick people and being aware of that and being understanding of other people's concerns about their health. So we know that the immunocompromised, like the elderly and maybe cancer recovering patients or individuals like that are at higher risk. So, I would advise people not to visit grandma and grandpa in the nursing home with sick children in tow. Just being aware of those things, and of course, staying home if you're sick, so that regardless if you have coronavirus or the flu or another cold virus, there's so many things that present in the realm of a respiratory illness that, it might be just a good idea to actually stay home. Hopefully you have some sick leave and take a week or so to recover before you head back to work or school.
Close to home, the South by Southwest event was canceled. Mm-hmm. Austin Mayor Adler announced, I guess it was this past Friday. Again, you and I are having this conversation on March 9th, but Mayor Adler announced that South by Southwest was canceled. Seen other stories out on the internet about maybe some other large events that bring people together from not just the U.S., but around the world. There's consideration of other things being canceled. Do you think those are prudent steps being taken by authorities?
I would not envy Mayor Adler's position or the governor or any other entity that's trying to plan or has planned and put in place events. I have multiple colleagues that have had national conferences canceled, with mm-hmm. over 20, 30, 50,000 people supposed to be heading to, Orlando, Florida. And, it's a tough situation. If you ask my personal opinion and kind of professional opinion, I think we may be going just a tad overboard on some of this because you worry about the obvious concerns around other impacts to the economy and people being reimbursed. And just the list goes on, and it kind of makes
Sure.
your head spin. And to think about the mayor or, the person that's putting together something as big as South by Southwest or the Olympics, and of course, when you get into other countries, that becomes a little more understandable if you're thinking about hot spots. If you're thinking about Italy or China, they definitely need to be thinking about those things a little closer. So I guess in the sense of what's happening in the U.S. being concerned about that, I don't disagree completely with some of the actions that are being taken. I just hope that we all continue to kind of look at all the evidence and try to come to some measures that even if we do cancel something, that we're kind of thinking about the consideration of those that have input maybe a ton of resources and time, and can we find a balance there?
I noted how this story is all over the place. Of course, the media helps with the distribution of information. You yourself have been a resource for a number of media outlets. But in looking at the media, and I'm not just talking about the coronavirus, the current situation, but how does the media help or at times cause problems for those in public health throughout the healthcare world?
Yeah, that's a great question. I know we've kind of discussed this before on your show regarding health literacy and other types of things around science communication. Certainly, the media, whether it's kind of old school media or the new social media kind of distribution of information, is helpful when you're trying to get important information rapidly across large, geopolitical kinds of situations. But what you worry about, of course, is that double-edged sword of maybe something starts circulating that has a tinge of truth that came from a place of maybe trying to help, but they just went down a rabbit hole where they didn't have the expertise on, like the mask situation and how devastating that is to everybody running out and buying masks and things like that, when really who needs those are healthcare workers and those who are actually positive. You really don't need one in your normal daily activity if you're washing your hands and kind of taking care of those things we mentioned before. You're actually hurting those healthcare professionals that we need to protect. So, Bill, one of the things I kind of continue to talk about this is the type of message that can be helpful that gets out, because If we lose healthcare workers, including medical lab professionals like mine, or nursing like your wife or others, those experts aren't replaced tomorrow. You can't train a nurse or a medical lab professional, from a different perspective and just have them start working tomorrow. There's so many issues around protecting themselves and the patient. And so we need to be careful of that and be cognizant of what we are doing as professionals and spreading information and make sure it's, the most accurate that we can get out there.
You came on the show back in 2016, one of your visits, Dr. Rohde, and look at the calendar. That was the lead up to that election cycle back in 2016. Newsflash, election 2020 continues.
Time flies, doesn't it?
Time flies, it does. So can you give us 2 or 3 topics? And I know there are a myriad of things that we could discuss, but what are 2 or 3 topics? And we don't need to tackle insurance or the drug companies. That story's out there. Thank you, CNN, MSNBC, and Fox. But what are a few things in public health that you want candidates or current office holders to be addressing at this point?
Boy, this is a great question. So you mentioned the other things. We all know we need to address insurance and drug company issues, but I'm going to talk about something I think I've mentioned before. I've definitely written about it, and I continue to kind of bang this drum, and I will continue this drum, is the idea that the United States, and even globally, but let's talk about the United States, we must do a better job, because we can do a better job, of funding public health and healthcare, but especially public health, not just general funding in the sense that, they want more money for things, but in preparation of future professionals. That includes future educational programs that provide us more nursing, more doctors, more medical laboratory professionals. Many of these things, we're at severe personnel shortages. So, we've talked about my profession that a lot of the public doesn't understand because we're in that laboratory in the hospital or in the public health labs of CDC or the Texas Department of Health, and we are hurting for experts. Many people have retired. We haven't, done a good job of funding public health in the sense of not just machines, but people. We need more FTEs. We need more boots on the ground so that we have a workforce that is knowledgeable and can react to these types of events in real time. It's really difficult, and we appreciate the $8 billion that was just passed in the U.S. for this crisis. But as you know, you're playing catch up when you kind of react instead of being proactive. So that's one big issue that I think, and I hope not only the candidates, but the general public starts coming to terms with, is that you can't ramp up overnight or over 1 month to deal with a global crisis like this. You have to have stockpiles of supplies, masks, drugs, other protective issues around what you're going to wear if you're a healthcare worker. You have to have contingency plans and support for policy around areas of how you would prioritize. For instance, maybe you take over a university setting to become a temporary hospital if you have to just have space. Just all of these things that you might have in place so that you could turn to them when time comes. And then, of course, the funding that you need to spread that out and to help other countries and states be more effective. So that is my top priority right now when I think about the candidates running for office, and at every level, not just the president, but every level. They need to kind of get on board with this and realize we need ongoing, eternal kind of line item support. It's as important as education, and it's as important as anything you would think about with respect to your health.
And you bring up a good point as well, Dr. Rohde. I think as part of the conversation, so much focus is placed on the federal level, whereas, and we here at the show understand that there is a lot that needs to be done at the state and local level as well. So I appreciate you pointing that out. And as I said in the intro to the segment, Dr. Rohde, you're a busy gentleman. You were kind enough, and this is for our listeners, Dr. Rohde was kind enough to share some information about some research appearances and other background on what Dr. Rohde is involved with. So I will encourage everybody to go to the description of the podcast, and Kevin Henderson's been kind enough to list some of that information there. So Dr. Rohde, again, thank you so much for coming by the show. And again, if you want to add to your resume that you're now the most tenured guest on the show, feel free to include that in any information you want to put out there.
Absolutely. It's kind of like that 5-time appearance on SNL. I'm reaching up there in the Tom Hanks ranks now, so that's great.
Congratulations. So, Dr. Rohde, again, thank you so much. All the best. And if anything should come across your radar that we can share with our audience, as always, please let us know.
Absolutely. Thank you so much, Bill, for this opportunity. I really do appreciate what you do and what we are trying to do collectively. And hopefully this will fade and we'll be talking about something else come next fall. That's my hope.
Here in Season 6, as we went through our planning, we decided to change things up from the past few seasons. Rick Jennings, yes, our producer, but has added the esteemed title of Maestro of all things Crazy Bids. Rick, it's great to see you. Well, I've seen you, but you know what I mean. It's awesome to get the show up and running again. What do you have in your maiden voyage on the good ship we call Crazy Bids?
Thanks, Bill. I've been looking forward to getting back into the studio for sure, and this has been a great episode to do so. Well, for this episode's Crazy Bid, I did some digging into the Bid Prime database, and I found a pretty interesting one. In Canada, the Saskatchewan Government Insurance Corporation has posted an opportunity titled Cleaning Services for Moose Jaw Salvage. Not inherently interesting by the title itself, but you'll find during a quick search that Moose Jaw Salvage is a government-owned and funded junkyard in Moose Jaw, Saskatchewan. So we all know the government seeks to procure a pretty wide, or I guess in this case it's the widest variety of goods and services. Just saying, it was really interesting to find that a Canadian government organization thought that it would be a really good idea to own and operate a junkyard for like automotive spare parts, things like that. And the reason this was so interesting to me is because I have a pretty entertaining mental image of the person from the company that wins this bid. They come in, they're ready to clean and maintain this junkyard, and probably going to be a little bit confused as to what junk needs to be cleaned up and what is actually a sellable product. So anyways, if you have a janitorial group that can sell your services in Moose Jaw, Saskatchewan, then that is this week's crazy bid that you can win. So, Bill, what do you think? Would you like to have the job of cleaning a government-owned scrapyard?
Thank you for that generous offer, Rick, but I think I'll take a pass. Stay tuned for Rick's future editions of Crazy Bids, and we're also, throughout the season, going to have our incredible guest. So many thanks to our friend and public health expert, Dr. Rodney Rohde. Kevin put in a lot of work. Again, please keep an eye out for the launch of thebigbidtheory.com and tell your friends and relatives about the website. We appreciate you for tuning in, sharing, downloading, and following the show, The Big Bid Theory. Help us spread the word. I enjoyed the emails over the break. If so inclined, you can email me at bculhane@bidprime.com. Follow us on Twitter at The Big Bid Theory, and or my personal Twitter is contract_hunter. We're also on Facebook, of course. Powered by Bid Prime. That's a wrap on episode 1 of season 6. Thanks again to Dr. Rohde. Kudos to Rick Jennings, Kevin Henderson, and the rest of our team. You heard Dr. Rohde. If you want actual reliable information on COVID-19, remember the CDC's website and follow Dr. Rohde. Those are great places to start. This is Bill Culhane. Until next time, go Gunners, Barracudas, Tigers, Bobcats, and Cubs, and we wish you all the best in growing your business.
Powered by Bid Prime, we thank you for tuning in to The Big Bid Theory. From Austin, Texas, the show is produced by Bill Culhane and Jim Ward. Producer and engineer is Rick Jennings. Distribution, research, and production assistance by Kevin Henderson. You can find other episodes of the show on platforms such as iHeart, iTunes, Spreaker, Google Play, Stitcher, and among others. As always, thank you for downloading and sharing the podcast.